And we're live. We already have 3 people on. So welcome everybody and to the VBF 30th anniversary month of awareness Facebook Live. Very, very exciting one with world-renowned laser expert Dr. Roy Geronemus of the Laser and Skin Surgery Center of New York. Welcome, Dr. Geronemus.
Pleasure to be here. Thank you, Linda.
Yep. Isn't it exciting that it's our 30th anniversary?
Well, you've done a great job. You've expanded the knowledge and awareness of vascular birthmarks to an enormous amount of people, and it's been a tremendous service to patients and families. Excuse my voice.
I know. Well, we'll try to keep it brief. I know you're recovering, but thank you for even being on. So we will be able to take your questions as soon as you have a comment or question. For those 7 of you on, please let me know where you're from. All those that are logging on, tell us what city or country you're from and ask your question. So tell us your city, your country, ask a question, or just say hi, because I see 10 of you are on, but I'm not seeing any comments yet. Let me. Okay. There we go. Oh, hi, Elaine. Hi. So they're all watching, Elaine. I see them all, but I'm not seeing any questions yet. So we're here for 1 hour, 60 minutes with Dr. Geronemus. I know you've all been seeing the post that I did about the weekly treatments. I know you've seen all the posts I've been doing about the new lasers coming out, new and improved options from the ASLMS meeting and the new ISPA meeting I just came back from. Hi, everybody. Hello they're watching. Let us know where you're from. Ashley from Mississippi. Elaine is from Canada. Hello, hello, hello. And Tom is from Ontario. Hello. So we are here today, and I'll have Dr. G talk a minute because a lot of people are on, but they haven't asked any questions. So how excited are you about this new weekly protocol?
Well, it's been a big advance. We've been using the weekly protocol for newborns, and we just published this in the Journal of the American Academy of Dermatology, the JAMA Dermatology, Journal of the American Medical Association Dermatology section. And what we have found is that if we begin to treat the newborns on a weekly basis, that we're getting more clearing and more rapid clearing. And also a benefit is they don't get the bruising. So that's reassuring to the families and also provides the rationale for our treatment. So one of the things.
Why don't they get the purpura, the newborns?
It's not exactly clear, but this is something that we observed years ago, where patients would not get bruising when we began treatment early on. I had published a paper from our group about 10 or 15 years ago, looking at the comparison of intervals between 2, 3, and 4 weeks. And we found that those patients who were treated at 2 and 3 week intervals relative to 4-week intervals with the newborns did better. And then in the past, I guess about a year and a half, 2 years ago, there was a study published that showed that revascularization, in other words, the regrowth of blood vessels, occurred at about a week. So the thought was, well, if the blood vessels are recurring at about a week, why don't we retreat at a week or before a week? And keep in mind that if we don't get the purpura or the bruising, then perhaps we have an opportunity. And in fact, that turned out to be true. So we did a series of patients with weekly intervals, and the responses were more dramatic, very reassuring to the families because they were able to see the results of the treatment more quickly. And it led to a more rapid reassurance that we're on the right track. And of course, getting more clearing than we had in the past, I think was a real bonus.
It's so exciting.
It's something that's a little bit cumbersome to come back on a weekly basis. It's more cumbersome for the families and also for the physician. for us, you have to accommodate these babies more frequently. Not everybody can do that, but if you make it a priority, I think it can be very, very helpful.
Well,
But
I think too, I've heard from some families, because you're doing them once a week, you could be reaching maximum clearance within 8 weeks, really.
well, in many cases that was true. We didn't get 100% in all patients, and some families choose to continue treatment looking for more improvement. A lot of that depends upon the location on the body, with the face clearing more quickly relative to the extremities, but also on the extremities, it's a much better chance of getting more significant clearing if you begin very, very early, as opposed to waiting longer.
And one of your colleagues, Dr. Linda Rabinowitz, says hi, and she was very
Oh,
excited
great.
about your recent paper. So we've got questions. We've got Emily Bauman from Waco, Texas. Thank you for everything you both have done for the VBARS community. Could you speak a little bit on the benefit of the shorter length treatment intervals? My 4-month-old is currently getting PDL on his port wine every 4 weeks, but we're trying to move it to 2.
Well, we found in the first few months of life, if you can get to the weekly, that's even better. Once they begin to see the bruising or purpura, then we do lengthen the intervals a little bit. But I think even there, we like to go shorter. I would go to 2 weeks when possible. Of course,
So
your physician has to be comfortable with that. And
basically, you're saying as soon as the purpura is gone, you can treat again.
that's correct.
Jackie Lally says hi from Chicago. My daughter Lena has been treated by Dr. G starting at 4 weeks. She had 16 treatments. See you at the conference. Forever grateful for both of you. Thank you, Jackie, for
That's
that.
kind. Say hello, hello.
Lots of people writing in. Hi, Michelle from Italiano. Ciao. Edith Guerrero. Do you speak Spanish? I can read it to you. Hola, soy de Ciudad Juárez. Mi hija tiene un hemangioma en el nariz y su cachete, saying something about a hemangiol on beta blocker. I mean, if you want it, you send your email to me, vbfpresident@gmail.com, and we'll get it translated so we can write
Or
back.
do Google Translate, send it to you.
Yeah, or use Google Translate and then get your question and just submit it back to us and we can read it. Mahela Bonds, I'm saying hello. And got Dora's mom and everybody. Barb Humphreys is on. Hi, Ava. Kamal at Adaman is on. Hello. Jessica Job. Hi from Indiana. My daughter is 6 months old and started treatment at 5 weeks. Let's just take a moment to think about that, Roy, and how great we've made the change over the last 20 years from every 6 months to even down to a month to 3 weeks. I mean,
Or even treating babies. There's still some resistance to that out there.
but look at what was going on, 10 years ago. So this is phenomenal. She will have her first treatment tomorrow. Our dermatologist has the opposite thoughts and will only do treatments every 6 weeks, no earlier, and will not treat her eyelid until 1 year of age. How do I address this at her appointment? We will see you in New York at the conference.
Well, the physician has to be comfortable with whatever technique he or she chooses to use. And you can't force someone to do something that they're not either trained to do or comfortable doing. But the data, I believe, now supports early intervention, frequent treatments, and we do treat eyelids, from day one. So I don't see that there's any medical reason why it can't be done. It just may be a personal preference on the physician's part.
And if we see them at the conference, you'll be happy to treat the eyelid and the whole birthmark.
There you go.
Hi, Ashley. She wants to know, what are the latest treatments for port wine on the forehead and nose? Is it possible for there to be brain issues later in life?
Well, when you see any involvement of the forehead or forehead and cheek, temple, scalp, you have to think about the Sturge-Weber syndrome. So the answer, is yes, there can be underlying issues. So I think it's worth being evaluated for that purpose. So we send every patient for an ophthalmologic exam to make sure there's no glaucoma or any vascular lesion inside the eye and the retina. And also, depending upon the distribution and the extent of the involvement, there is the potential for neurologic involvement as well. So I think it's very, very important. And, when I see patients in consultation, that's the first thing we talk about, because in many ways, that's more important than the skin.
Thank you for that. Liv McGregor says, hi, Dr. Linda and Dr. G. I've been in touch with both of you at various times about my daughter, Georgia, who has a port wine on her face and neck. We live in New Zealand. We saw great progress with her treatment, but after a long episode of eczema, the redness returned and we have resumed treatment, but are still a long way off. We are thinking about bringing her to New York City for the super clinic, but it's a long way, 20 hours. The birthmark goes in her mouth, so we would really like to get that checked. We will get from the, what will we get from the consultation? Will the laser be able to get us a plan for the appointment settings for the future? Oh, will she be able to get settings? Georgia will be 18 months at the conference. Well, I can answer that. We've got Dave Darrow and Dr. Coletti, who are both doing intraoral exams for gums and gums and tongue or palate involvement. And there should be nothing that would stop you from doing the laser. So, I mean, that's what we can give her. We're doing ultrasounds, we're doing dental checks, Sturge-Weber eval, and free laser and consultation.
Yeah, and we
And
encourage people who are coming to the conference to take the parameters that we use with them. But
yes,
keep in mind that our technology is a little bit different. We are using the Prima device and also the Derma V. So the Prima, has a larger spot size and higher energy, and also uses both devices use post cooling. So we believe that the larger spot size makes a very big difference, and that's part of our recent paper, is those patients were generally treated with spot sizes that are typically much larger or not significantly larger, but not, depending upon the technique of the physician, 13 to 15 millimeters, which has two advantages. One, I think the laser light actually penetrates better with a larger spot size. It also makes for a faster treatment. So that is something that makes the treatment more comfortable and less traumatic for everybody involved. The other point about the cooling modification, now the lasers that are generally used for port wine treatments involve dynamic cooling. And typically the dynamic cooling has been delivered prior to each laser pulse. And more recently, we've added post-cooling. And so we're using the cooling both before and after each laser pulse. And we've seen a demonstrable change in the discomfort from the patients. So the parents notice it, the patients themselves who are able to explain to us what they're experiencing notice it, and I think it's a very important advance. So not only are we protecting the skin with a dynamic cooling spray, but we're minimizing the discomfort to a larger degree.
and you told me once when you increase from like a 7 to 10 spot size up to 13, you're literally like cutting the number of pulses and time to treat like by 40 or 50%.
Sometimes more than that, Linda.
Yeah,
Think of
I
it
mean,
as, the circumference, pi r squared.
right.
So if you go from 7 millimeter spot size, which is 49, compared to, a 15, which would be what, 225 or something like that, that's 5 times more. So
Quicker, yeah, 5
yeah,
times. It'll
almost 5.
cover the surface 5 times faster.
Right. So that's a big deal when you're treating, a large area or even a small area, because you're making it a much simpler procedure for the patients.
And I mean, you could literally have newborns that you're literally doing 3 to 5 zaps on and you're covering that whole area.
That happened to me today. I was treating a little baby on the the forehead and upper eyelid, and the procedure itself was less than 10 seconds.
Wow.
So it's a big deal.
Wow.
Because there are some physicians, and I get this when I lecture, where there's some resistance to what we're doing, because that people feel that, you know, the children should be under anesthesia. Now, I don't believe that, unless it's absolutely necessary. And I think with some of these young babies, particularly with the US FDA having a warning on repetitive exposures to general anesthesia under the age of 3, I think it's a very, very important thing to be able to provide these procedures more quickly and with more comfort.
Thank you. We have a lot of questions coming in. Nicola wants to know, she said, I have 2 daughters with port wine stains on their face. Are there many other cases of siblings and port wine stain?
I wonder if this is a midline port wine stain.
She doesn't say, but I know you're talking like what they call the angel kiss.
Yeah, there's some they look like angel kisses, but they're not, and they
I know.
persist. And I have seen these on a familial basis where it's what we call autosomal dominant, where one of the parents has it, and then the children or a child may have it. So I wonder if that's one of those. This is one of those scenarios.
Yeah, she'll circle us back in. Hurrah, Eve, I can answer your question. She wants to know if there's a clinic in DC, and that would be Dr. Pooja Soja. And we just had a free clinic with her in May. She's listed on our website under DC, so look for Dr. Pooja Soja, and she's phenomenal. She just did a laser clinic. I can't highly recommend her enough. We have, Mahela says, hello, Dr. G and Dr. Linda. And then she said, I'll see you soon, Dr. Linda, in Milan. Dr. Goldberg's going with us on this trip. So we got to get you there with us, Dr. G, for one of the Milan clinics. So Heidi says, my son is 19. He has significant port wine stain on his cheek and neck. Any new options for him? We typically go yearly for maintenance. We have treated aggressively in the past. He usually has significant bruising and is in college, so it's hard to get treatment. We travel to California to treat at the moment. Even going aggressively, we never seem to see any improvement. That is why we have just moved to yearly maintenance.
Well, I think there are a number of different options that one has available now. Looking at these larger spot sizes, I think can be helpful, maybe deeper penetration. Sometimes with some resisting cases, we've been combining other technologies, including the radio frequency with microneedling. So I think the combination approach can be helpful. Other physicians are combining it with other types of lasers or radio frequency devices to safely deliver more heat and get more destruction of the blood vessels. So there are additional options that one has available today. So I wouldn't necessarily give up just yet.
And no 2 technicians modulate the settings with the skin type and everything together. As I was saying at a meeting in ISFA, there's a factor we all forget, and it's the confidence factor. And you kind of alluded to that before.
No, I think one has to be comfortable for sure. But just to that point, I think the patients across the world will be seeing more changes in technology in the next 6 months to a year. For example, you know, aside from the Derma V, which also offers the larger spot size and the post cooling, Candela will be offering the V-Beam Pro. This is the successor laser to the Prima and the V-Beam Perfecta.
And when will you be getting that to test?
Now that I don't know as of yet, but I think the company is looking for either a late 2024 launch or an early 2025. I don't know for sure.
Yeah, this is very exciting because this is bigger spot size, better. Just this is where we're going, you know, bigger spot sizes, makes it quicker, shorter. And also you mentioned FDA, but the American Academy of Pediatrics and American Pediatric Neurological Association also caution not to have more than 3 GAs under the age of 3. So
GA meaning general anesthesia.
general anesthesia, right? Thank you. So Dora from Croatia says, I have a 1-month-old daughter with port wine. First treatment will be on the 7th of July. Well, it's June 7th. So make sure you're there, Dora. It is June 7th in Milan by Dr. Coletti. I would like to know, is it possible to treat the entire area in one treatment if it's 18% of the body? Also, can newborns be treated with an ND YAG? What is the minimal recovery time after treatment with YAG? Can we use air transport, fly 24 hours after treatment?
So most Nd:YAG lasers should not be used in children, most. And I can't say that all, and of course it depends on how it's used. But the Nd:YAG lasers in inexperienced hands or hands that are not overly experienced can be much more risky. One of the beautiful things that we've seen from our treatments to date is that we generally do not see scarring. It's a very, very rare event. I never say never, but it's not something we typically see, but it is much more common with the YAG laser. But with that said, there are some newer YAG lasers out there that have a lot of potential. For example, the YAG laser from a company called Cyton is very interesting, and we're starting to look at that as well. I've been using that more for mature port wine stains. Candela also has a YAG laser that they're using for more mature port wine stains as well. But in babies, young children, I would just encourage abundant caution in using a YAG laser, and would prefer either the pulse dye laser or a KTP laser, the DermaV.
Are those YAG lasers like what they call the long gentle pulse?
That is one company, but there are other YAG lasers that are out there, and some people are enamored by them because they penetrate more deeply and have the potential to cause more destruction to the blood vessel, but they're not as safe as the other lasers that are out there, particularly the pulse dye laser.
So that's why your preference is more for adults, older patients rather than
Yeah, I
children.
mean, ultimately, I think, as these newer YAG lasers come out, mid YAG lasers come out, we can begin to investigate whether we could do something better with the younger children, but we're not there yet.
Okay. Laura from the UK said, I've been told that my daughter, who is 5 months old, will not be treated under 3 years of age under GA. The dermatologist most local to us does not want to treat without GA, hence the recommendation, nothing before age 3. I have a second opinion at GOSH. What are the questions to ask, and what is the right treatment for facial port wine? One is on her cheek, her neck, into her ear, and scalp. Thank you for your time.
Well, what I would do is, go online and find some of the articles we've written and present them to the doctors and say, why don't you do this? Or find somebody who does. So
Right.
I think it's a lost opportunity not to treat earlier. And I don't mean to be critical of anybody else. Everyone has their own preferences. But we've done this thousands of times. We have performed thousands of treatments in young children under the age of 3.
Yeah, I believe you treat the most patients a month than any other doctor in the world, because I've never heard of anyone treating more than you in a month.
Well, regardless of that, I mean, I think we've proven time and time and time again that you can treat these young children. And we've also proven that early intervention can make a very big difference. It's just easier for the patient, it's easier for the family, and the results are better. I mean, there's so many compelling reasons.
So
So,
we
yeah, Linda, do you have anybody to recommend in England for them?
So at Alder Hay, I believe her name is Brennan, and she's a facial plastic surgeon that's doing laser. And we also check out our website for the UK, because I believe there was a young doctor from the ASLMS that I met, and he said he was treating. So I added him to our website, so you can go and get a consult. I just don't remember his name, but it is for the UK, and I believe he's in London. Oh, Sarah Ravitch says hi to Dr. Linda, and and Dr. Geronemus, and that they love us both.
So have
Paula,
one.
Paula Nesbitt said, "Hi, Dr. Linda and Dr. G. Is there any treatment to stop the growth of the lips? My son is 4 and his lower lip is showing signs of growth. It's been treated by laser 3 times so far."
Well, in my experience, laser treatment does not necessarily stop the growth of the lip or the hypertrophy of the lip. I mean, that's unfortunate, but true. I don't think the laser penetrates deeply enough to have any impact on the ultimate overgrowth of what we call the subcutaneous tissue.
But
So
I know there's some new approaches with the new treatments like the HIFU, high intensity focused ultrasound, and the electrosclerotherapy. They're both being experimented with. I saw demos at ISFA for treating hypertrophic lips. And there was a presentation that the hypertrophic lip is a different mutation than the port wine. It has an extra mutation, which I'm not surprised about because Dr. Mim used to say that all the time, that it was probably PIK3CA because it's an overgrowth syndrome. Lainey said, "Is there anything that we can do to assist healing between lasers? As of now, we use Aquaphor and Cerolimus topical cream."
we don't use anything because I don't think anything makes a big difference. The Aquaphor should not be necessary unless there's crusting. So in the vast majority of cases, the laser treatment is performed and there's just bruising. So Aquaphor is not going to do anything for that. So all the action is going on below the skin. Whether you can improve the bruising through arnica or doing a second laser treatment in a different setting, perhaps that could be helpful. But
I was also thinking of something new to talk to you about, which is when the patients leave and they have the purpura. Isn't that an important time to like really gob on the zinc oxide? Because there is like I think the ultraviolet light would be very attracted to that purpuric response because it's thermal and
I think yes, in general, I think it's helpful to use a sunblock. One, I'm a dermatologist, so it's a good idea anyway.
right.
And I also treat skin cancer. And 2, I do think it's helpful to avoid hyperpigmentation. And there are some people who believe that ultraviolet light exposure, sun exposure, can actually exacerbate the birthmark a little bit.
Yep. So thank you for that. Carrie said, "Hi from Charlotte. We hope to be in New York City for the super clinic. My grandson is 2.5, had an MRI at Duke, a venous malformation. We will take him back, but last we heard from them, they were delaying treatment. It's near the eye and sweeps with crying. We think he may need early intervention. They did not do an ultrasound. If you come to our super clinic, there'll be ultrasounds and there'll be, we're actually working on bringing an eye expert, but certainly between Dr. Nasseri and Dr. Coletti with their 2 ultrasounds, they'll be able to give you some more information on this type of lesion and options for intervention. I've seen the picture and it is by that right near the eye, so I'm not sure if it's pretty small, if it is venous. Is that something you might be able to treat?
Yes, this is one instance where we do use the YAG laser for venous malformations. But many of the venous malformations can have an underlying component. So we often work hand in hand with interventional radiologists for the purpose of addressing the underlying component through the interventional radiologist and then treating the superficial component by laser. Many times we go with the interventional radiology approach first to get to the underlying component if it exists, and then following up with the laser afterwards.
Thank you for that. Cynthia says, "I'm 42 years old. I have a port wine stain on most of my right arm, upper chest, shoulder, and never really bothered me or changed until a few years ago. It started showing dark spots and a burning sensation under the sun. Is that something to worry about?"
Well, the burning, not necessarily, but the bumps, can be treated. The bumps that do have the potential to bleed. So this is one of the reasons why we do treat patients to begin with when they're younger, is to avoid this degree of change. And typically we see in 2/3 of all patients by the age of 45 have some thickness or bumpiness or cobblestoning of the birthmark. So one of the reasons we treat is to prevent that from progressing or prevent that from happening. But once it happens, there are some things that you can do. Whether it would help the sensitivity that you describe, I'm not sure. But there are many things that can be done to improve the bumpiness of the skin.
Thank you for that. Hello to Joey Davidow from Rome and Dr. O from Korea that I met at the AASLMS meeting, and he's the one that I told you about is taking your protocol back to Korea and treating weekly. He said, I'm going to do it.
Right.
So we're excited. You gotta follow up with me, Dr. O, and let us know. Spila says, hello from Slovenia. Congratulations on your article on the new approach of treatment weekly. Do you think we could also treat older kids in the future with this approach?
So that's a good question. Typically what we have done is waited for the bruising to fade and the healing to occur. As people get older and they do have a little bit of sun damage in their skin, there's the risk of increasing pigmentation of the skin. So we've been a bit more conservative about that, particularly with the darker skin types. So for some patients who are Hispanic, Asian, Latin, any kind of darker skin, I think that gets a little riskier. Lighter skin patients probably can get away with something more frequent, but I think the weekly might be a bit much with that bruising still there. And I could be wrong. Maybe we should be treating through the bruising. So, look, I don't know everything. Maybe there's a better way to do it. So we'd like to find out at some point. Yes.
Maybe we'll be doing that reporting next year
There you go.
on treating through have you ever treated through purpura?
We have, just at different parameters in an effort to minimize the purpura. So we had patients come back and we would treat them differently just to help the bruising disappear more quickly.
Ashley said she started having a number of cognitive issues in the last few years. She's 53. She's seen two neurosurgeons and they said she would have either MS or Sturge-Weber, but they did some testing and said it's not MS, thank God. She said, I'm exhausted and don't know what to do. So now they're saying she has an AVM in her brain. If you can get to our super clinic, you can meet with Dr. Ann Comey, who's the leading Sturge-Weber neurologist in the country, maybe even in the world. And you can bring any records with you that you have, and she will review them all with you, and you can get an ultrasound and see the team, and I'm sure we can come up with some information for you. Also, at your age, this is where we do see changes occurring because it's usually pre or in or post-menopausal that we see changes in women. So that would make sense that you've been having some issues. And it could be Sturge-Weber, but let's have you come to the super clinic. And it's all free, plus you get free lodging for one night. But you'll meet with a team of amazing doctors, and then Dr. G will be there as well, doing the free laser. So Tom Davies said, our son is 6.5 years old, has been receiving treatment for 4 years from Ontario, Canada. Would an MRI show how deep or thick the port wine stain is, and or when treatment should be focused more on maintenance? We are struggling with recommendations on time period between treatments. I guess he's saying if you can get an MRI, will it tell you the thickness of a port wine? But I don't believe that does.
No, but an MRI would address if there's something underlying. If somebody does have thickness of the skin or, some type of pulsation, then something like an MRA or an angiogram could be helpful. So.
And we also have the free clinic, which is ultrasounds, which can also be helpful. Obviously, they don't go through the brain, but they can be helpful for some. So if you want, Tom, you can email me. I can give you Dr. Comey's email, or you can let me know where you live and I can tell you, or you're in Canada. I would consider coming to our conference because then you're going to see everybody that treats all of these. Let me get down. We have tons of people that are on. Nicole King. The babies, the two siblings, their birthmarks are around the eyes and the eyebrow area and a bit on the cheek. So that could be midline.
Around
Remember
the
the ones?
eyes, what was the description?
She's saying they're around the eyes and a tad on the eyebrow area and on the cheek.
Yeah, if it's on the cheek, it wouldn't be the midline variant.
No.
So it'd be
But
unusual to have siblings with that type of involvement.
yeah, the midline is right here. Here,
Right.
right, like it goes right here, like it can be a V. Yesterday I saw an up down. Yesterday I saw a kid with bilateral port rind, Dr. G, and he had an inverted, so it looked like a triangle, and his skin was spared in the triangle and spared down the nose, spared in the philtrum, and spared on the chin, but on this side and on this side. Isn't that fascinating?
There are variations.
So a rather long one from Mari Joyanga. My son has port wine on his V2, V3, left face and right V3, as well as intraoral, gums, lips. He's had 17 treatments. I've had two questions. One, I'm noticing changes, bigger growth in teeth on the affected side. Any recommendation? And what are the anesthesia options you have seen for 2 to 5 year olds? My son has not been able to go through it since 18 months due to hesitation. We are due for general anesthesia soon. He's 2.5 years old, but as an anesthetist, I'm interested to know, anesthetist, she's an anesthetist. I'm interested to know how laser is being done in ages where it's difficult to hold the babies down. Is it always general anesthesia?
Well, I think a lot depends on the size of the malformation of the birthmark. So it's a very, very large area. Then as these kids get older, it's a little harder to treat. Again, I think as these lasers continue to improve and the spot sizes are larger and the cooling gets better, so it's more comfortable, that opens up more opportunities and limits the need for anesthesia even more. But there are instances where anesthesia, can be very, very helpful for the patient.
Thank you for that. Natalie says, we were placed in maintenance after 18 treatments started at birth for a V2 port wine. He is now 2, and we were told not to be concerned with resuming until he is able to comply and be willing to participate in order to avoid general anesthesia. Clearance was about 40%. Do you disagree that in terms of achieving better capillary bed minimization, how are you navigating restraint of children over 2, and is numbing recommended by you?
Well, there are several questions that are raised here
Right.
and several observations. One is the V2 area, which is this part of the cheek, is the most challenging area on the face. And some of them are just much more resistant to treatment. So it could be that you may see less improvement in that area, and you may not get as much clearing as you would get from other parts of the face. That's just the way it is. That's just a fact. Also, I would want to know what the parameters were of the treatment. So even though there have been multiple treatments, there are different ways to administer the lasers, and there are different parameters, some of which work better than others. So one of the things that we try to do when we're hitting a roadblock is to take a look at our parameters and perhaps make some modifications. Maybe it's a larger spot size, maybe it's a shorter pulse width, maybe it's a different energy. My colleague Stuart Nelson out in California varies the laser parameters in a single session, which we do in some circumstances if the patient's compliant. where you do a second pass or even third at different laser parameters, ways to improve the outcome. So I think one of the things we really want to do is to take a look and see whether there are alternative options that might lead to a better outcome.
Okay. This is a great question. Dr. G, are you currently doing the DermaV on kids?
We've done some. We haven't pushed it as much as we should have, but so far it's been safe, but we don't have a direct comparison to comment on whether it's any better or as good as the newer laser pulse dye lasers with the larger spot sizes.
Thank
But
you
it
for that.
appears to be safe. And one of the things about it, it's very fast. So with the large spot sizes and the post cooling, you can accomplish a lot in a short time.
So when you say very fast, like what, half a nanosecond or?
No, 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 no. I don't think you can deliver the spray and repeat the treatments, but the ability to use that large spot size consistently over a large area up to 15 millimeters, can make it a much faster treatment.
And less painful.
And less painful.
So hi to Cambria and Wallace and Lauren. Hello, Lauren. Hello, Lindsay. Lots of people joining us. Alana, Aisha, Yakar, Nicole. What do we protect the skin with? Sunscreen?
Sunscreen is all we do.
And do you have any particular one?
I think 30 or higher. The most important thing with a sunscreen is to use it. So you want to make sure it's something that's comfortable. I prefer the mineral sunscreens. There's some controversy about some of the chemicals that are in the other sunscreens, and I don't know whether that's a valid controversy or not. But in general, when possible, we like to use the mineral sunscreens.
So you mean like zinc oxide?
Exactly.
Right. Thank you for that. Doris says, is it possible to predict how many treatments will be needed during consultations?
No, it's not possible to do that. It varies from person to person. It varies upon location of the birthmark. It varies upon pigmentation of the skin. So there are a number of different considerations that one has in determining the number of treatments. And again, also a lot depends on what the goals are. So with our data, we're getting, 80 to 90% improvement in many of our patients on the face and to a lesser degree on the body, on the extremities. The chest and back do particularly well. The upper arm do particularly well. So there are a number of factors that one has to consider in making a suggestion or a recommendation or a prediction in terms of how someone's going to do.
That's what I always tell them. I say there are so many variables. There's skin type, there's the location of the stain, there's the density, because we know some of them are extremely confluent and dense, and some are, like you say, the midline ones are so shallow, and even if they are a capillary, they respond quicker. So it's the type of lesion, the density, the skin type, the technical device you're using, they all could be different. So that's why I tell everyone there's just no way to predict. You can make a broad guesstimate, but that's about all you could do. And
yeah, I mean, like we talked about earlier, when you have the central part of the face, the mid cheek near the nose, that's going to be generally slower unless, and this is an important consideration, and it may not be relevant to many people on this Zoom call, you get to it very, very early. And I think that makes a huge difference.
thank you for that. Rachel, I love this question, Rachel Louise. I was thinking of this myself. Is arnica safe to use post-treatment to help the bruising heal quicker?
It's safe. I don't know how effective it is, but it's generally very safe.
So if any of you moms out there use it, and you could keep track of when you don't use it, how long it takes for the purpura to go away, and then you do use it, and if it shortens it, can you please message me at vbfpresident@gmail.com, because I'd like to collect that information if it is a possibility, because it's safe and pretty readily available. And I know people are using it for bruising, and I did myself and saw a great improvement. Like I had a bruise and I put it on right away, and within 18 hours, the bruise was gone.
So there's a difference between bruising from external sources and also from laser treatment. So it's hard to generalize whether or not that would be helpful, but I really haven't heard much benefit from my patients in evaluating or trying to improve the bruising that one sees after treatment.
So Melinda Anderson says, hi, my 4-year-old son has a small but stubborn port wine on his cheek. He's had 15 treatments, mostly with Dr. Nelson, one with Dr. G at the conference. It's been over a year since treatment, as I am hesitant due to hypopigmentation surrounding his birthmark. The port wine now has a lighter halo ring around it. Is it still worth continuing treatments despite this? I'm hoping for better technology for stubborn port wine stains in the future.
Well, the halo around it should resolve, first of all, so I'm not concerned about that. I wouldn't expect to see permanent loss of pigmentation from this treatment unless the skin is extremely dark, and even then typically comes back over time as well. So I think it's worth taking a look at the parameters to see if there's something that might work better than what you had before. It's also important to take a look at the history and get your observations as to what worked best in terms of the treatments. So I mean, there are some lesions that just don't get better, but that's farther and further between than one might expect.
Thank you for that. This is rapidly going. We only have a little over 15 minutes left. We haven't any downtime. Sharon, hi Sharon, she's been with VBF for a while. And thank you, she said, always, and she's always following us. She has a large facial port wine stain, and she's had 16 treatments so far. And she just says, bless you to both of you. Not really a question. She just wanted to say that. Hi, Barb. Barb Humphreys is on.
Yeah, Mark.
I know Dr. G said hi. I know there's been strong evidence in the importance of post-treatment cooling. Other than post-treatment cooling in the device, does external cooling with ice packs and or cool cloths make a difference?
I've not found it to be particularly helpful, but if you have, I'd like to hear that. So
Yeah, let us know, Barb. So Luca Jelovic says, hello all, I have a question related to Klippel-Trenaunay syndrome. My 1-month-old newborn was diagnosed with port wine stain along with KTS. For now, we have been told that it is possible to treat the port wine with a laser and achieve some results. Is there anything that can be done about the KTS to reduce the consequences or alleviate them? I mean, the baby's 1 month old, so you can treat,
yes, you can.
right?
Yes.
And I mean, you've treated people that have had extremity lesions and probably been going on to be diagnosed with KTS, and you're seeing clearance, right?
Well, it's harder if they have extensive KTS, but I think our best chance for lightening or clearing is earlier on and doing the multiple treatment approach, keeping in mind that our best results are above the knee. And once we get onto the lower leg or the lower arm below the elbow onto the hand or foot, the response is more slow and not as much.
The more distal from the heart, right?
Yes,
Yeah.
exactly.
And the most responsive area, is it midline?
Responsive on the extremities or?
No, on the face, the most responsive.
No, I think everything except for the mid cheek, this part of the cheek, the thicker areas often respond more slowly.
Okay. Cynthia says, thank you. Even though I am 42 years old, can I go to New York to be checked officially because I'm originally from Mexico and my parents took me with several physicians, but never really suggested laser. You're more than happy to sign up at birthmark.org. We don't really have a diagnosis from you here. I'm assuming you're talking about a port wine stain, and it doesn't matter how old she is, right? You can start treatment at any age. Correct, Dr. G?
Absolutely. We've seen people showing up in their 70s and 80s for their first treatment.
That's amazing. Mari says, following on from your comment about weekly treatments and caution with hyperpigmentation, you talked about darker skin attributing to hyperpigmentation. Are there any other risk factors to hypo or hyper from the laser, and are there modifiable risk factors?
Yes, I mean, the other thing that we try to avoid is a suntan. So people who come in with tan, particularly on the extremities, can often end up with some loss of pigmentation, but it generally comes back over time, so it's not typically permanent. So I think being really very cautious before you come in for treatment, using a sunblock, avoiding sun is particularly important, as well as being careful after the treatment as well.
And I also tell a lot of patients, you have to make sure the physician that's treating with the laser or the expert understands the skin types. It's not one setting fits all. And the darker the skin, you modify your settings,
All the
correct?
time,
Yeah.
we treat black skin, but we're much more conservative, and it's not cookbook. There are no set parameters. You really have to look and see what the response is after each treatment, or actually each laser pulse, to make sure you're not going to end up with a problem of any kind.
Thank you. Carrie, this is amazing. Her son is 13 and he has a V2 port wine and he's had over 70 treatments. He's going through puberty, so we are increasing frequency from 8 weeks to 6. At what point do you decide to put your patients into maintenance?
Well, we generally decide to put patients into maintenance where we've done a series of treatments and there's no response, or when there are no other options for making a change. So if we can change the parameters, change the device, if there's newer technology, then it might be worth continuing. But I think if you hit a roadblock, then sometimes it's worth taking a break. And we do that periodically. Sometimes you can get delayed lightning. So that could be something that one needs to keep in mind, that you can see a delayed response after a series of treatments. But maintenance is something that we do recommend if we're just not making significant progress.
So this is an interesting question from New Zealand. Sorry about this, Sam. He said, I'm a new VBAR parent and our public hospital senior dermatologist has said laser treatment is cosmetic only. Is there any link between treatment and hypertrophy or noduling? She was seen at 4 months and is now 7, with a plan to visit in a couple months to see if we want to do any treatment.
Well, I got to tell you, Linda, that infuriates me. It takes a lot to get me going, but that one really gets me going. I've seen enough of these patients over the years to know and to believe that treatment does minimize the thickening, the cobblestoning, the hypertrophy. I saw a patient just the other day where I had treated her face. I didn't treat the scalp because I didn't want to impact the hair. And she had bleeding lesions in the scalp that required a surgical procedure. And she had showed me pictures of blood dripping down her face from the scalp nodularity or hypertrophy. So to call this cosmetic, I think, is really unfair and unjust and not medically sound. I hate to be critical of anybody else, but I've got very strong feelings about it.
As do I, which is why VBF exists, to try
That's
to
correct.
get them all on the same page. Seema says, hello from London. We will be attending your clinic in October. My 7-month-old son has a port wine affecting the right side of his face, his right neck area below the occiput. His neck area was treated for the first time 3 weeks ago, and post-scabbing, the skin appears as overlapping hypopigmented rings. Is this scarring or likely to heal, disappear?
So if it's flat and there's no change in texture, it should heal, and the colors should come back over time. But I think the lesson here for the treating physician is to be a bit more cautious next time around.
Yeah, because she did say there's scabbing.
Yeah, ideally you don't want scabbing with these treatments. I mean, it can happen every now and then. I mean, there's just, you don't know why. You could do the same thing 1,000 times at one time. You may get some scabbing, but you don't want it diffusely over the entire area.
Good point. Ashley says, where can I find research or articles? This is a good one about the latest on port wine stains for treating adult women. And that might be because of the hormone thing, because we do see a lot of changes. So maybe it's patience and aging. I don't know.
Yeah, you could go online to something called PubMed, P-U-B Med, M-E-D, and then put in a search under that topic, and you can get a number of different references to what you're asking about. So
I'm gonna do that myself because I'm interested to hear. Ashley says, hi from Boston. I have 8-month-old identical twins. Lucky you. One has a significant port wine stain on his face, chest, arm, and back, and has treatment with, and he has been diagnosed with Sturge Weber. His twin has a patch on his left calf. I have read that people can have Sturge Weber and no birthmark. Is it worth getting him looked at even though he doesn't have the port wine on his face because they are identical? You should come to our conference. It's free. Bring those twins.
I mean, it's highly unlikely that the twin would have a problem. Yes, it has been reported that the triad of Sturge Weber, of the seizures or the neurological issues, the ophthalmologic issues in the skin can exist without a significant birthmark, but that's very rare.
And this is important too, because when people talk about the mutations, obviously this is somatic and that's how it's been published. But, germline, like they're both have some sort, but it's still, the GNAQ is still published as somatic. So maybe it's just two random occurrences. I don't know. The answer. But we have a couple more questions and we only have 6 minutes left. Sarah says, my son just turned 1. His birthmark is from his cheek, chest, shoulder, down his arm. He had very dark purpura at 10 days old and got good results. What does it mean when infants have purpura? I also wanted to ask, when you go through your multiple sessions and plateau and begin maintenance, why are some kids able to go one time annually and get the same clearance, and others get their treatment and later into adulthood and don't get the same clearance?
Well, there are a number of questions there, but just in terms of why is there differences? You want to look at anatomical areas. Number 1, you want to look at treatment parameters. Number 2, 3, you want to look at the pigmentation of the skin. So there are all kinds of reasons why there might be differences amongst the different patients.
And Natalie's just saying, so grateful for you both. Thank you for taking the time. You're a blessing to this community. Hillary Connor said, I'm 55 and have a port wine covering 1/3 of my face, but I have deep tissue vascular malformation in and on my nose. I even have growths inside my nostrils. When I was 30, I had a vascular growth removed from the side of my head. But I'm curious how deep tissue AVMs of the nose could be treated now.
Well, this is a very important question, and this could be a very different condition than what we've been talking about. So if in fact there's something growing inside the nose and that there's thickening of the cheek, then you definitely need a further evaluation to make sure that this malformation doesn't go further into the underlying tissue or the brain. So I would think evaluation by a neurologist or interventional radiologist would be very much warranted at this time.
And also we have the free conference in the fall, and just as a cursory, you could see all the experts and get an ultrasound. It might, because Dr. Coletti can pick up a lot on those, like AVM,
But
CM.
I think it's important that this particular patient get further evaluation sooner than later.
And see an interventional radiologist.
Right, and I think particularly
That's,
at this age, you want to be very much aware and make sure the diagnosis is clear, as hormonal replacement therapy is often considered at this age,
yeah.
women, so you want to be cautious about that as well.
She's near Hackensack University in New Jersey. Do you know of anyone there?
Um, well, David Goldberg is there as a dermatologist. He's quite knowledgeable, but
And
they should have they have great neurologists there as well.
yeah, he's on our website.
Right.
So if you go to birthmark.org, find a doctor, you can see Dr. David Goldberg in Hackensack, New Jersey, dermatologist. My 7-month-old has what looks like a 2P size port wine stain birthmarks just lateral to his right eye canthus. He was seen by ophthalmology around 3 months, and we were advised that there were no concerns. Do they usually need long-term follow-up in these cases based on the location of his port wine?
If it's above the eye, for sure, long-term follow-up would be indicated. Outside the eye, it's possible, but less likely that there'd be a long-term issue.
Dennis Fiorino said, "Hi, Dr. G."
And Dennis, long time.
Maria Galvin is saying, oh, can't, it's in Spanish. We have, where are we at? 2 minutes. Doug Rubin, hi, Dr.
Hey, Doug.
Geronemus. Rubin here. I know it's been a long time. I promise I'll be back for treatments.
Linda, one comment for you before we go. Is that a screen behind you?
Nope, that's the VBF display board.
Okay, so if you look at the patient on the left screen, on the left panel behind you, the young child, the second one, this one.
This one, right?
I have a photograph of her at the age of 13.
Oh, yes, because it says port wine before and after by Dr. Roy Geronemus.
Right. So I have a photograph of her at 13 where she's remained clear.
Oh, we should
So
have that.
so just to bring that to your attention. Now we don't always see that. There can be some recurrence over time, but the more clearing that we get, the less likely we are to see any kind of recurrence.
Oh, quick question. Can they fly after 24 hours after treatment?
They can fly the same day.
Yep, that's what we tell them all. My toddler has PIK3CA and staining on his right side. We are treating his face and arm. He is sedated. His first one was in March, and we feel it is more noticeable now. Do you feel it can look worse before it gets better?
Well, you do get the bruising after treatment with patients older, a few months of age. So, I mean, yes, it can look worse. Sometimes you can actually begin to see, you can see some persistent redness depending upon the parameters that are used. So that's a possibility as well. So,
Do you know anything about a yellow laser for a 2-year-old's port wine stain?
well, the pulse dye lasers really are yellow light lasers.
And most of these people are saying thank you as we wind down. Has there been any new laser device? And you already mentioned that. Everybody, you can go back and watch this. We are at the end of our time. All of our YouTube, Facebook Live sessions are on our YouTube channel. You go up to birthmark.org, up to the right corner. And from 2017 until today, they're on there. We've had almost 200,000 hours of viewing of all of those Facebook Lives, all of them. You can go through them all with Dr. G and see all the progress made over these years. So thank you so much, Dr. G, for this
That's
time.
amazing what you just said. That's incredible. What a great service.
Yep.
Hey, thank you for what you're doing.
Yes, and thank you, and stay well, and we will see you all soon. Thank you, Dr. G.
Okay, my pleasure. Have a good night.
Good night.